Hello, everybody. It's time for the CMRTO webinar. Today, we're going to be talking about performing procedures for medical radiation and imaging technologists. So welcome. We're glad that you're here. There's over 150 people online, which is fantastic. And of course, this recording will be put on the website following today's presentation. My name is Linda Goff, and I'm the Registrar and CEO of the CMRTO, and I'm thrilled to be here to talk to you about our latest practice guideline and what it is that you need to know as a medical radiation and imaging technologist about performing procedures in Ontario. So we're going to talk about our new What You Must Know About and really focus on the 4 questions that MRTs and sonographers have to review every day. And then we're going to finish up with a couple of practice questions. So today's webinar is very much about your daily practice and the procedures that you do on your patients every single day. This is all what's new. On our website, we have a section under the resources called What You Must Know About. So there's a whole series of publications that we've put together to try and put in plain language concepts around legislation and other things that our members need to understand when they're practicing medical radiation and imaging technology. So they're all available on the website at all times. You can go and have a look at them. And today we're going to be talking about performing procedures for medical radiation and imaging technologists. This is our newest publication. It was sent to all our members yesterday by email, along with an updated version of our What You Must Know About mandatory reporting. And it's available online. There's our our website address, cmrto.org. And so this is a concept that all of you use every single day when you're looking at working and making sure that you have all the proper processes and policies in place when you're actually performing your work. And our standards of practice, practice standard number 1, talks about legislation and standards and ethics. And it says that our members must understand and adhere to the legislation governing the practice of the profession, the standards of practice set by the college, the code of ethics, and the bylaws of the college. And as you all know, the standards of practice of the profession set what it is that MRTs and sonographers must meet in their daily practice. And in fact, it can be considered professional misconduct for failing to meet the standards of practice. So it's really important that members know and understand all the legislative framework that governs the practice of the profession. So we have all this information available for our members on our website under resources, publications, and it's in a section called Practice Essentials. So this is an electronic book, and it replaces, remember the 3-ring binder that we sent out a few years ago that had the standards of practice, code of ethics, our QA program, all our What You Must Know Abouts. So this ebook now replaces the old print version of the binder because, of course, at the beginning of 2018, CMRTO went totally electronic. So you have the ebook available. Everything is there if you wanted to refer to it. All these documents are also available on our website and other locations, but this is like a giant PDF that has everything together in the one location. We also have our legislation learning package, which is available online and is free. And so our jurisprudence program provides our members and our applicants with all the information that they need to have to maintain and improve their understanding of the legislation and all the legal requirements they must meet in their day-to-day practice in medical radiation and imaging technology. So it covers 7 modules: legislation, standards of practice, QA, orders, abuse prevention, confidentiality and privacy, and consent. So you can always go and review this legislation learning package at any point in time. All of our applicants are required to complete it before they can become registered. And so we have a certificate of completion there. And so the sonographers, if there's any sonographers in the crowd, you will have done this very recently as part of your application process. But even with all this information that we provide to our members to help you figure out the legislation and how it works in your day-to-day practice, sometimes it still feels like a maze. Legislation is incredibly complicated. And the other thing is there's a lot of processes already built in that take care of some of these requirements. But you just need to know that it is a requirement and that you are taking care of it through the policies and the practices in your departments. So our new publication, at the very back, there is a decision-making guide for performing a procedure. And so this is a step-by-step process around 4 key questions that we hope will be able to help our members make sure that they have all the requirements in place before they perform the procedures. So the first question is, do I have the legal authority to perform the procedure? Of course, you can only practice if you are legally authorized to do so. And the public of Ontario and our patients are relying on the entire healthcare system that it is meeting all its legal requirements that have been put in place in order to protect them. And so the first question, do I have the legal authority to perform the procedure? And there's issues to consider, and we'll go through each one of these. And so after you've asked yourself these questions, if the answer to them is yes, then you would continue on to the next question. And if the answer is no, you do not perform the procedure and you take necessary action to correct the situation. And that's going to vary depending upon the situation and the conditions in your organization where you're practicing. So, so we won't get into those resolutions today, but we will pose some questions for you to be considering and thinking about as you go through your day-to-day practice. So the first issue to consider under this item is, does the procedure fall under the scope of practice of the profession as it's defined by the Medical Radiation Technology Act? And as you know, we have the Medical Radiation and Imaging Technology Act, which we hope will come into effect on January 1, 2019. If it doesn't come into force then, we expect that it will come into force shortly after that, a couple of months later. And so what we've done in this slide is we've put in brackets how things change when the MRIT Act comes into force. So under the MRT Act and the MRIT Act, it's defined, the scope of practice of the profession is defined as the practice of medical radiation and imaging. Technology is the use of ionizing radiation, electromagnetism, sound waves, and other prescribed forms of energy for the purposes of diagnostic and therapeutic procedures, the evaluation of images and data relating to the procedures, and the assessment of the individual before, during, and after the procedures. So that's the description of what it is that medical radiation and imaging technologists do every single day. So the first thing is you have to make sure the procedure you're doing falls under the scope of practice of the profession. The second item to consider is, does the procedure contain a controlled act? And if so, is the controlled act one that's authorized to medical radiation and imaging technologists under the MRT Act? So as you know, the Regulated Health Professions Act defines 14 controlled acts, and these are clinical activities that are deemed to pose a risk of harm to the public or to patients if they're performed by unqualified individuals. And then under the RHPA and the Health Profession Specific Act, professions are authorized to do certain controlled acts that support the practice of that profession or the scope of practice of that profession. So for medical radiation and imaging technologists, and these don't change under the MRIT Act, they stay the same, we are authorized to do 5 of the controlled acts, or we have 5 authorized acts. And it says in the course of engaging in the practice of the profession. So that's engaging in the practice of the profession as it's defined by the scope of practice statement that we just looked at in the previous slide. A member is authorized subject to the terms, conditions, and limitations imposed on their certificate of registration, and we'll look at that in a minute, to perform the following. So administering substances by injection or inhalation, tracheal suctioning of a tracheostomy, administering contrast media or putting an instrument, hand, or finger beyond 4 body orifices, performing a procedure on tissue below the dermis, and applying a prescribed form of energy. So wherever you see the word prescribed in a piece of legislation, it means there's a regulation there. And when we go there, it's called the Controlled Acts Regulation under the RHPA. There are 2 forms of energy under the RHPA that medical radiation and imaging technologists are authorized to apply. So that's electromagnetism for MR imaging and Soundwaves for diagnostic ultrasound. So just those 2. Of course, as you know, the Healing Arts Radiation Protection Act covers the ordering and application of ionizing radiation. So in order to do our authorized acts, there's a couple of other things that have to be in place. Do I have the necessary knowledge, skill, and judgment to perform the procedure safely? Oh, I'm sorry, I've gotten ahead of myself. Let me go back. Previous, there we go. So in order to do our authorized acts, we also need to have an order. So 3 things have to be in place to do our authorized acts. We need to have the legal authority to do it. So it needs to be an authorized act, has to be in the course of practicing the profession. So number 1, you have to be practicing under the scope of practice as defined under the MRT Act. You also have to have the knowledge, skill, and judgment to safely perform that procedure. And that's another condition that's required for MRTs and sonographers to be able to do our authorized acts. And the third thing that we need to have in place is an order from a referring physician or from an authorized health professional. So those 3 things we need to have: practicing the profession as defined by the scope of practice, knowledge, skill, and judgment, and also we need to have an order to perform our procedures. So if we have all those 3 things, then we are authorized to perform the authorized acts. So not every member is going to be doing all 5 authorized acts. It's going to depend upon your knowledge, skill, and judgment and the types of procedures that you're doing. And if we look at performing a procedure on tissue below the dermis, that's a huge authorized act, right? That includes everything from doing a skin prick to doing brain surgery. And you'll see it's not defined in the scope of, in the authorized act specifically which parts of that authorized or that controlled act that medical radiation and imaging technologists are doing, because we have these other 3 controls in place that protect the public. So of course, one of the things that we want to consider is, suppose we had someone who wanted to do brain surgery, and they're saying, so what's stopping me from doing brain surgery because I have this authorized act of performing a procedure on tissue below the dermis? Well, first of all, brain surgery is not part of the scope of practice of the profession as we just looked at it. Secondly, medical radiation and imaging technologists do not have the knowledge, skill, and judgment to perform brain surgery. It's not part of our educational programs. And thirdly, we wouldn't have an order from a physician or another authorized health professional to do it. So although some of these authorized acts look pretty big, they do become narrower when we look at how we practice the profession. And of course, what's included, what MRTs and sonographers do under there, is they do venipunctures, they do tattooing for radiation therapy procedures, they will do PICC line insertions, and those kinds of procedures, okay? So that's how that's all working. So we have our 5 authorized acts. The second one, do I have the necessary knowledge, skill, and judgment to perform the procedure safely, effectively, and ethically? So issues to consider under here. Do I have the necessary education and experience in this area of practice? So as of January 1, 2018, all of our members now have this new term, condition, and limitation that's on our certificates of registration that says the member shall practice only in the areas of medical radiation technology in which the member is educated and experienced. When the MRIT Act comes into force, that will change to the member shall practice only in the areas of medical radiation and imaging technology in which the member is educated and experienced. So what this does is it makes sure that our members have education and experience in their area of practice. And specifically, this addresses some of the concerns about diagnostic medical sonography, because of course you have the 3 areas of practice, general, cardiac, and vascular, that all have entry to practice requirements. So you can get a certificate of registration from CMRTO in the specialty of diagnostic medical sonography if you meet all the requirements for registration just in one of those areas of practice. So we do have registered sonographers who only have the area of practice of vascular, although it doesn't appear like that on their certificate of registration. They have a certificate in sonography, but in order to actually make sure that they are working only or practicing only where they have the education and experience, we have this additional requirement. And you also have to have the knowledge, skill, and judgment. And this is best reflected in our practice standard number 8. So members must have, maintain, and apply the necessary knowledge, skills, and judgment to ensure safe, effective, and ethical outcomes for the patient. Members must maintain their competence in their current area of practice and must refrain from acting if not competent. So notice it says current area of practice. And so, you know, when you think about it, this will take care of what our members do throughout their entire career. And when you first graduate and you first become registered, you know a little bit about a whole bunch of stuff, right? And then over the years, you become specialized in particular areas. You might move into dosimetry or CT or other specialized areas. And that's great. That's wonderful. You don't have to maintain your knowledge, skill, and judgment in all the other areas as long as you're competent in the current area in which you're practicing. But if you wanted to go back, or if you were practicing only in vascular sonography, and then you wanted to go and work in cardiac, you can do that. You can go and get additional education and experience. You could take a course, you could do a certification exam, or you could do on-the-job training. Just to make sure that you do have the necessary knowledge, skills, and judgment. Because as a self-regulated professional, you are responsible to make sure that you're competent for doing every single procedure that you're doing. Members must obtain and maintain the necessary knowledge, skills, and judgment to respond to changes in practice environments, advances in technology, and other emerging issues. And that you do all the time. The practice of medical radiation and imaging technology, there's always new procedures, always new equipment for you to make sure you're competent in. And then, of course, there's the quality assurance program that's part of maintaining and improving your competence. So that we have to think of entry to practice requirements. You've demonstrated that you're able to practice safely and you become registered with the college. And then it's up to you as individual self-regulated professionals to make sure that you maintain your competence throughout your career in the areas in which you're practicing, and that you're recording all that information in our QA program. When you gain new experience or new education, you don't need to notify CMRTO. You're going to record it, though, in your quality assurance program. So it's kind of post-grad training, and it moves from registration requirements to your ongoing competence and recording in QA. Okay? Other issues to consider. Are all the provisions in place for me to perform the procedure safely under the applicable legislation? Medical radiation and imaging technologists practice in highly regulated environments. We're dealing with dangerous substances, ionizing radiation, strong electromagnetic fields, radioactive materials. All these things are dangerous if they're in the hands of unqualified individuals. And so there's a lot of legislation that's put in place to protect the public, to protect other workers, to protect the environment from the materials that our members use every single day. So you want to make sure that you are following all those requirements and all that other legislation. So for example, if you're working with a piece of X-ray equipment and it breaks down, there's a fault, you are going to make sure you put a note on that equipment that it doesn't get used mistakenly by somebody else. You're going to report it to the appropriate quality control or repair person within your department, and you're going to follow all your departmental policies around making sure that the equipment's not used until it's safe to be used again. So that's just an example of what you do every single day to make sure that you are following all the legislation that is designed to protect the public and also to protect other workers. So that's important, right? Another issue to consider: are all the provisions in place for me to be responsible and accountable for the performing the procedure, and also for managing the outcomes? So this is an important piece, right? And for most cases, MRTs and sonographers are able to manage the outcomes of the procedures that you're doing. But where you're doing high risk procedures, so if you're injecting contrast and there's a risk that your patient would have an anaphylactic shock to the contrast, well, then you'd better make sure that you are able to identify the signs of anaphylactic shock and be able to respond. Because, of course, managing that outcome is beyond the scope of practice of a medical radiation technologist or diagnostic medical sonographer, nor do we have the knowledge, skills, and judgment to manage that kind of negative outcome. But you will be looking for signs, you'll know what to do, you'll know where the crash cart is, you'll call the code. All those things are done in order to protect your patient, and you need to make sure that you are taking care of that, because you cannot manage that outcome. Similarly, if you're doing stress testing on a patient and there's a requirement for your cardiologist to be close by, you're going to make sure your cardiologist is there before you actually start the stress test. So you're going to follow all those procedures to make sure that in those cases where you can't manage the outcomes, that you have all those safety measures in place. Number 3, is there an appropriate order in place giving me the authority to perform the procedure? So this is really important, because medical radiation and imaging technologists can only do their procedures on the order of an authorized health professional. And that can be either a direct order or through a medical directive. And it has to be to perform each component of the procedure that includes the application of ionizing radiation or electromagnetism or sound waves or any of our authorized acts. So, of course, a direct order is going to be for a particular patient, most likely to come from the referring physician. And then medical directives are often used in the departments, in the medical imaging or radiation therapy departments, to be for authorized acts as part of the procedure. So we'll go through this and just explore this a little bit more. So who can issue an order? This is where it all gets kind of confusing. And so what we've done in the publication is we've put everything together in charts so that you're able to see which legislation is linked to which kind of procedure it is that you're going to be doing. So, of course, the application of ionizing radiation is under the Healing Arts Radiation Protection Act. An order for nuclear medicine procedures, that has to be done in accordance with the Public Hospitals Act or the Independent Health Facilities Act. The application of electromagnetism, that's under the Controlled Acts regulation under the RHPA, along with sound waves for diagnostic medical sonography, also under the Controlled Acts regulation of the RHPA. And then we have all our authorized acts, excluding the application of electromagnetism and sound waves. And so for those, the order must be from a physician, and that again is under the Medical Radiation and Imaging Technology Act. So what type of orders exist? We have our direct orders under any of these areas, which is going to be an order for a particular patient for a particular procedure, and usually from a referring physician. Medical directives or protocols are set up in the departments for things like contrast injections or for radiopharmaceutical injections and other authorized acts that are listed in the above chart that you're going to be doing for the procedure. Appendix A has what we've done in the publication is we have 3 appendices, and Appendix A talks about the ordering and application of ionizing radiation. So everything is up to date here, and you just have to go to this one place to find it all. So who can order? well, a physician is able to order and is also able to apply. So a legally qualified medical practitioner, which is a member of the College of Physicians and Surgeons of Ontario. So they can order all kinds of procedures, and they can also apply ionizing radiation. A member of the Royal College of Dental Surgeons of Ontario is also authorized to order the application of ionizing radiation for dental radiographs and dental CTs, and they have the authority to apply. Now notice on these, both these requirements, the dentist is accountable to adhere to the expectations set out in the practice standards of their college. So just like members of CMRTO, you have to adhere to our standards of practice. Other regulated health professionals have to adhere to the standards of their regulatory college when they are practicing their profession. So a member of the College of Chiropodists, so they're the feet people, they are authorized to order and to apply. Also a member of the College of Chiropractors can order and apply. A member of the College of Nurses in the extended class, so that's a nurse practitioner, is able to order x-rays except CTs. So you'll recall that the nurse practitioners for many years had a list of particular x-rays they were able to order. That list is now gone, and they are able to order all x-rays except CTs. But they are not authorized to apply ionizing radiation. A member of the College of Physiotherapists, the legislation says that they can order in a manner prescribed by the regulation, but there is no regulation. So right now, physiotherapists are not able to order x-rays under the Healing Arts Radiation Protection Act. But of course, many physiotherapists do through medical directives, those that are involved in joint replacement clinics, those kinds of things. Then there are medical directives in place to assist so that the patient is able to get the kinds of x-rays they need. A member of the College of Dental Hygienists have no ordering authority under HARP, but they do have the authority to apply ionizing radiation. And our members, again, have no ordering authority, but yes, we do have the authority to apply ionizing radiation. So that's how all that is working under HARP. Then we have Appendix B for MR. This is the easiest one. So a member of the College of Physicians and Surgeons has the authority to order and also to apply. And a member of the College of Medical Radiation Technologists cannot order, but we can apply if we have an order from a member of the College of Physicians and Surgeons. Here we are for Soundwaves for diagnostic ultrasound, Appendix 6. A member of CPSO can order the application of Soundwaves and also has the authority to apply. A member of the College of Midwives has the authority to order the application of Soundwaves for pregnancy diagnostic ultrasound or pelvic diagnostic ultrasound. And they also have the authority to apply Soundwaves for pregnancy or pelvic diagnostic ultrasound. Now, just because midwives have the authority to apply Soundwaves doesn't mean that they're going to be doing a full 13-week scan on their patients. What they are going to be doing is using Soundwaves to supplement their practice, so to help them. So they're looking for things like the position of the placenta or the positions of the baby's head as they're going through helping this patient and managing the patient's pregnancy and delivery. So you can see it. Just because they have the authority doesn't mean that they're doing the full examination that diagnostic medical sonographers would. And members of the College of Nurses in the extended class, so the nurse practitioners, can order the application of Soundwaves, and similarly, they have the authority to apply. A member of the College of Nurses other than a nurse practitioner is not able to order, but they can apply if there is a therapeutic nurse-patient relationship. And also, the application is being done for conducting one or more routine nursing assessments. So they can use sonography to supplement or help them in their nursing assessments. So the kinds of things that they are doing is checking the urinary retention in patient's bladder following surgery to find out if they need to catheterize that patient, those kinds of things. So very much to supplement the nursing practice. And then, of course, a member of the College of Medical Radiation Technologists of Ontario, we cannot order, but we can apply, providing that we have an order from an authorized health professional. So there we are, that's who can order and who can apply Soundwaves. So if we think about a radiation or an imaging procedure with contrast media, so we need to have that order for the application of ionizing radiation, magnetic resonance, or sound waves. And usually that's a direct order from the ordering physician, nurse practitioner, or midwife, depending upon the form of energy. And then to do the contrast injection, then we need to have an order from a physician. And that's going to be, it could either be a direct order from a radiologist or a radiation oncologist, or it could be done through a medical directive. So all the kinds of patients who are going to have this particular nuclear medicine procedure, then you're going to administer this kind of radionuclide with this dosage. So you can see how it can be a direct order or also a medical directive or protocol, okay? But we need to make sure we've got an order for each part of that procedure that we're doing. Number 4 is have all the conditions set out in the CMRTO Standards of Practice been met. So this is where the practice really gets very specialized on what our members are expert in. So things to consider. Has the patient provided informed consent for the procedure? And we have a What You Must Know About the Healthcare Consent Act that talks about this. And informed consent is not an event, it is a process. The patient has to understand what is going to happen, what the procedure is, what the risks are of the procedure, what would happen if they don't have the procedure, what the alternatives are to the procedure. And in order to have informed consent, they need to know all that. And if you think about it, one person can't explain all that to them because one person doesn't have the answers to all that. So that's why we have to think of consent as a process. So the referring physician is going to get consent for the patient to actually have the procedure ordered. They know what kind of procedure they're going to have. And then when they come to the imaging or the radiation therapy department, that's where the medical radiation and imaging technologist is going to explain in detail what's going to happen and why you're going to do all these things. When, where, and why you're going to touch the patient. So you're checking for consent throughout the procedure. And don't forget that a patient can withdraw consent verbally at any point throughout the procedure. So MRTs and sonographers, you're always checking for consent with every patient that you're doing and throughout the entire procedure. Another issue to consider, am I able to provide the patient with clear and understandable information and instruction regarding the procedure and respond to their questions? So we have a What You Must Know About communicating with patients. And this is really important. Communication is one of the most difficult things to do in healthcare. We work in very high volume situations. We have short times with our patients. And so it's really important to make sure that your patient understands what's going on, and that if they have any questions, that you're able to respond to them. And every procedure that medical radiation and imaging technologists do on a patient is going to have a huge impact on that patient. And patients are anxious, right? They're anxious about the outcome. Is this procedure going to cure my cancer? Has my cancer come back? Has Granny got a broken hip, and are we going to have to move her into long-term care? All kinds of things that the work that you do every day has a massive impact on patients. And on the whole, our members are doing an absolutely terrific job every day, making sure that your patients are well taken care of and feeling comfortable in the very difficult procedures that you do. So kudos to all the MRTs and sonographers in this area, but it is the hardest area. So it's always an area that we need to be sensitive to and make sure that we slow down enough and ask the patient to make sure that you've got consent, and also if they have any questions, that you're able to respond to those. Other issues: are all the provisions in place for me to be responsible and accountable for performing the procedure in accordance with our Standards of Practice Code of Ethics and the Sexual Abuse Prevention Program? So again, we have our What You Must Know About Sexual Abuse Prevention. This is an important area, especially for sonographers, and especially in the very sensitive areas where you're doing transvaginal examinations. You want to make sure that your patient understands what's going to happen and why the procedure needs to be done. And you want to make sure that you have consent for doing that procedure. And of course, our standards have our 8 areas and things that you're dealing with every single day. In fact, all of them you're dealing with every single day. They all mean something to every patient that you are treating or imaging. If all your answers to all the questions that we've posed is yes, then you can move down our decision-making chart and you can perform the procedure. So who knew that every single procedure that you do, these are all the things that are in place to make sure that you are adhering to the legislation and that your patient is taken care of and you're able to manage the outcomes. So we hope that you'll find this decision-making guide helpful when you're developing processes or policies or medical directives. We've got a couple of practice questions. Practice question number 1. Do students have the legal authority to practice after they have completed their program and before they become registered? And the answer to this, of course, is no. And this is an issue for sonographers because after January 1, 2019, you must be registered with CMRTO in order to be able to apply Soundwaves for diagnostic ultrasound procedures. And so students in all 5 specialties cannot work before they're registered with the college. What happens when they're students is there is an exemption both under the RHPA and under the HARP Act that enables the student to perform the authorized acts and to apply ionizing radiation while they're part of an approved educational program and while they're supervised by a member of the profession. So as long as they're a student of an approved program and they're supervised, this exemption applies. Of course, once they've completed their program, they're no longer a student. So the exemption no longer applies. What we do is we work with the students to try and make sure that we've got everything in place in the application process so that as soon as they get the results of their certification examination, we can register them and get them to work quickly. Usually the managers are wanting them to because there's vacation coming up, those kinds of things. So we do try to make sure that we shorten that time frame as much as we can, but it is an issue, and it's a change for the sonography students. Practice question number 2. Can a CMRTO member in the specialty of diagnostic medical sonography perform fetal ultrasound for non-medical reasons? So we've all seen these come see your beautiful baby in 3D, 4D, and moms go home with their pictures and their teddy bear with the heartbeat recording. And the answer to this is no. So CMRTO members can only perform their authorized acts when engaged in the practice of the profession and when there is an order for the procedure. And of course, applying sound waves is an authorized act. And so the use of sound waves for the purposes of diagnostic or therapeutic procedures, the evaluation of images and data related to the procedures, and the assessment of the individual before, during, and after the procedures, that's the scope of practice statement. And so that is not happening in the entertainment area of sonography. So no, CMRTO members would not be authorized to perform a procedure on a fetus for non-medical purposes, because they're not engaged in the practice of the profession and they would not have an order for the procedure. So that brings us to the end. You can get more information on our website. You can also call. We have a practice advisor now. Tina White is our practice advisor, and Janet Maggio is our QA manager. So they can answer all your questions about QA and practice advice too. What's new is on our website. You can always check out things there. And so we have talked about these things. Oh, we've got another webinar coming up next week, what you must know about mandatory reporting and complaints. And little reminders, just make sure that you continue to read your email, review your practice essentials. If you are a sonographer, make sure you get your application in so that we're able to process it and register you by the end of the year so that you can practice on January 1, 2019. Thank you all so much for your attention, and we'll see you next week.